Let me start by stating very clearly to Mr Abbott how nurses and midwives feel about this issue. Mr Abbott, Medicare is sacred, it's not for sale, it must not be undermined. We don't want a system where when you walk in the door, the first thing that's asked is, have you got the co-payment?
Australia has one of the best health systems in the world, and it's our job, every one of us here, to keep it that way.
You're going to be told we can't afford to have a health system that looks after everybody. You're going to be told that we can't do those things. It's nonsense. We need to build up Medicare, not tear it down.
It's not just the budget of 2014. It is the budget that's going to set the agenda for this country for the future.
We believe that the principles on which Medicare was founded must be preserved: equity, efficiency and universality.
You've managed to galvanise every sector of the healthcare sector against your co-payment. This attack on Medicare and universal healthcare is driven by liberal ideology, not necessity.
Nurses and midwives are at the bedside 24/7. So we know the system inside out, upside down and back to front, and we should be out there, and we will be out there. Everybody has one of those little green cards and they want to protect it.
It is our belief the $7 co-payment is just the first of many attacks on the principles of Medicare. Make no mistake, it's all part of a bigger strategy to absolutely dismantle our health insurance scheme and downgrade free public hospital and community health services to nothing but a safety net for the poor.
This increased cost will impact disproportionately on vulnerable groups in our society.
Getting access to a doctor and health should not depend on your bank balance. It's a fundamental principle of being Australian.
No way! Tony Abbott, hear us say, Medicare!
As an old age pensioner, I cannot afford the premiums or the gap that is paid when you do have membership. And I'm here today to plead with you, Mr. Abbott, to please give our country back to us.
We spend 9% of our GDP on health. The United States, that these characters so want us to become, spends 18% of their GDP. For half the price, we get twice the help.
Good healthcare is equal access, it's preventative health, it's early intervention. It is not delaying health until illness and disease sets in. Medicare is the people's health system. It is not the government's to dismantle and sell off.
Now the campaign gets harder because now the government's become more devious. It's trying to shift the whole discussion away from the political realm to the realm of that between the patient and their doctor, which is appalling.
We stand for a universal access healthcare system where if they need the care, they get the care. That is what makes Australian health system one of the best in the world, and we want to maintain it that way.